Hello and welcome to episode 26 of the Dental Realist podcast. I am Dr. Ryder Waldron, and with me as usual, Dr. Marcus D. Neff and Dr. Troy Stevens. Marcus, how's it going today?
Hey, things are good. We're enjoying a little fall weather around here. We had a lot of rain last week. It's nice to have a little bit of sunshine for a break.
Yeah, this fall weather has been nice, and this is our first episode that we've recorded in the fall. It's kind of like we're coming back from I don't know, what is it, the new season of Dental Realist podcast is starting up or something. I don't know.
Yeah, that's
Well, there
right.
you go.
Yeah, the first one was
Summer
like
break.
February, wasn't it?
Of last year, I think.
Last year, yeah, that's right.
Yeah. Well, Troy, how's it going with you? We're just about through our dental week, so how's it been
Yes.
treating you so far?
It's been a weird week for me. Just kind of hit and miss. Some days busy, some days doing nothing. So, really strange week for me. I don't know. Strange stuff. There's something in the air.
There's something in the air. Well, maybe tonight's topic will help you figure out why you're busy some days and why you're not other days. I don't know.
Yeah, we're gonna find out.
Yeah. So I think we've got a good topic tonight. Marcus, I'm going to let Marcus introduce this because he kind of came up with it. So Marcus, take it away and explain how we came to this topic.
Yeah, so a few weeks ago, I was in Las Vegas at a business of dentistry seminar or conference put on by Dentrix. It's a really big conference. Maybe some of our listeners have been to it. That was my first time being there, but they have a whole bunch of breakout sessions, and one of the sessions was talking about kind of the state of the dental industry, and I thought it would be an interesting course to sit through, and it really was. They talked about a lot of the different trends that are going on right now in dentistry and kind of where it's going to be leading dentists and the dental industry over the next several years and into the future. So they shared a lot of slides. It was really interesting stuff. It was Kevin Henry and Teresa Duncan were the presenters. Anyway, so there's a variety of things that they presented that I think our listeners are going to find interesting and might help them in navigating their careers, their business moving forward.
Mm-hmm.
Yeah, I think so. Some of us might find it terrifying. I don't know.
Right.
That is true.
I don't know.
It was pretty eye-opening how blunt they were about some of this stuff.
Yeah, when I was reading through some of these notes, I thought, wow, yeah, that's me. That pertains to my office. Yeah. So, okay, well, let's get right into it. So, one of the first things they talked about was that 42% of dentists currently were born before the baby boom or during the baby boom. So they're getting up there in age, and they said up until the year 2024, it's projected that many of these dentists will actually retire, and corporate entities will actually purchase their practices. So, Marcus, how do you feel this will affect dentistry with all these corporations buying up existing practices?
Well, I think it's going to change the job opportunities and the work situation for new dentists, especially the ones that are going to be graduating. There probably won't be the practices out there to go purchase. I know when we all finished school around 2003, I think that was a pretty common thing for a lot of new dentists to do, is go out and try to find an existing practice to purchase, because that's one way to get into the business of dentistry, is to find an existing practice where there's an older dentist ready to retire, go work for him for a year or two, and then buy him out, and voila, you got an instant practice. So if those practices are all dried up and gone, where are you going to go practice? You're going to go do a startup with $500,000 in student loan debt? Is a bank going to even loan you that kind of money so that you can do a startup? So I think the job prospects will be more in line with large groups, corporate dentistry, that kind of thing, as we head into these next 10 years.
Yeah, that's true. I never thought of that, because you couldn't do a startup. I mean, it's hard to do a startup now, or when we got out of school, it'd be almost impossible to do one and then try to compete with all these corporations and stuff pumping money into it. Troy,
Yeah.
You were born during the baby boom, weren't you?
No, actually, I was not close, but no. Thank you.
Well, how do you see this this affecting dentistry?
Yeah, I mean, Marcus hit the nail on the head. We've discussed it in the past about corporations taking over the world now in dentistry, and I'm thinking also as you were reading that, and we've been thinking about this, is it kind of makes sense for a corporate entity to go buy up these private practices, because they've already got a patient base, right? So all they've got to do is buy it up, put a dentist in there, and boom, you got an operating practice that's probably, generating revenue for you. So it makes sense on the corporate side. The problem is, if you did want to be your own boss, you're just coming out of school today, you're going to have a really rough time achieving that goal.
Yeah, that's true. And did they say, Marcus, like when they're buying up these practices, say they're, I don't know what you would, I don't know, just make up your dental corporation name. Are they rebranding the practices they purchase as this corporation, or do they still, make it seem like the individually owned dentist practice, or are they turning them all into like a chain?
Yeah, that's a good question. I don't remember if they did say anything about that. I don't remember it coming up. But in my mind, I'm thinking they would probably want to turn it into their brand or their chain.
Yeah.
Or if nothing else, transition over just a short period of time and call it whatever corporate entity that it is.
That's a good question, Ryder. Brings up something that we had happen here in my town. There was a pediatric dentist that had a bunch of practices around, and they called it Playhouse. And when the corporation bought them out, they actually have not changed the name. It is still Playhouse. However, some of the employees left because they weren't happy with the new corporate structure, but they have not changed the name.
That's interesting. Yeah, I've heard of corporations buying out dentists like that, buying their practices and then allowing the dentist to keep working for them, and then the dentist getting fired from their own practice like within a year. I've heard of a couple of different instances of that happening. I don't know if you guys have heard any of that, but that would sure suck, I would think.
Well, I don't know. Would it suck?
I don't know. Yeah, good point. I don't know.
I mean, maybe give you an opportunity to start afresh.
Yeah, that's true. Yeah, that gives you an excuse to get out, I guess. I don't know. Let me make a note of that.
Yeah,
I don't
right.
know.
Let's see. When a corporation comes to buy your practice, you can think that maybe I'll only have a job for another year.
Yeah. I don't know if I've seen a lot of the corporations buying practices up around here, but I know that a lot of the corporations just start up fresh around here. So I guess, like you said, Marcus, it makes sense for them to buy an existing practice and have a built-in patient base and not have to put all the money into marketing and all that they do already. So,
Yeah.
Well, another thing they brought up was that dentists on average are working 19 fewer days per year than in 1990. So let's see, the stat was that in 1990, dentists worked about 226 days a year. Now we're working about 206 days a year. What do you think, Troy, is attributed to that?
I thinking about that, I'm kind of thinking why I have maybe chosen to work less days. And that, I would say it's probably stress related. I used to work 5 days a week when we first came out of school, probably for about 5 or 6 years, 5 days a week, no problem. But it got to a point where it was just topping me off. I don't know, I don't know if I could put my finger on exactly the reason why, but it's just, the frustrations that come with everyday stuff that we do, that we've talked about in previous podcasts and stuff. But I don't know, that could be one of the reasons why, is just, when you talk to that many people a week, you get worn out. You can't even function hardly. At least I can't. I just, it's bothered me over the years.
If I'm remembering right, I think during this meeting they talked about how the newer generation of dentists over these last several years is a little more focused on kind of what they call the work-life balance, and so dentists aren't wanting to completely commit to 5 days a week, 8 to 5 every day. They're wanting a little more of a balance so that they can enjoy life, and that seems to be just a general thing throughout society too. But like Troy said, I think he's right. I mean, it's a really stressful career in a lot of ways, and so for a lot of people, it's it's tough to work as many days, year in and year out.
Yeah, when we had Steve Parker on our last episode, he said he recommends that the dentists he works with take a week off every quarter, and I don't think I take a week off every quarter. I probably should, because that would probably help a ton to look forward to that week off. But I think that's probably good. I think producing more but working less is probably the way to go. So Yeah. I guess
Another
that makes
thing
sense.
that one of the reasons why we cut back to Monday through Thursday was, with our staff, we have 12 staff now. We used to have 14. We only have 12 now. But then you can schedule days. Like for example, we know that you're going to be working this many times. You can schedule doctor's appointments or whatever you can on Fridays, which allows us to kind of streamline the staff. They know that they'll be working this day, so take Friday, get your doctor's appointments, to get your, your car getting fixed, your oil change, whatever you got to do, the stuff they would normally miss work for. Do that on that day we have off, so that we can maximize the time we're there.
Yeah, that's a good idea. Yeah, and you're right, Troy. It's stressful, and you feel like you're emotionally drained by the end of the week. So I think if we can work harder and work better while we're there, but
Can we bring up one other thing on that, Ryder?
Yeah.
Just before we got on the show today, we could almost not get Ryder to talk because he was so emotionally wasted.
Oh my gosh. Okay, yeah. So I guess I could tell everybody what happened.
Tell your story.
At about 4:30, I started extracting a number 30. It was root canaled. It had, I believe the roots were about 45 millimeters long. No, they were probably. I mean, they were long for a molar, and the distal root was sectioned from decay. So you had like the mesial root holding on this crown. Anyway, I got the mesial roots out. I got the crown out, but the distal buccal root was just there, and I could not get that dang thing out. And I tried. I cut bone away. I did everything, and I was emotionally and physically spent. So I think it's a victory that I'm even here right now.
Yes. Well, we are glad you're here.
I know.
I mean, I don't know what Marcus and I would do without you.
I know. We have a nation to entertain.
That's
we
right.
have a world almost.
Yes, but that's one of. I mean, can you imagine doing, things like
imagine
that
doing that all the time.
5 days a week?
Gosh.
But like we talked about a couple podcasts ago about Howard Ferran, how he's like, well, if you're in debt, you're going to be working 6 days a week. You can't stop. It's like, dude, you're gonna die. You're gonna stress and you're gonna stroke and you're gonna have a heart attack, whatever.
Yeah, I think working less is probably a great thing because you've got to recover. But dentists feel guilty for taking time off. They act like their practice is going to fall apart, and I'm guilty of the same thing. I act like if I take a day off, my staff's not getting paid, my patients can't be seen, all that stuff, and it's nuts. In any other career, you don't usually feel too bad about taking a day off.
Yeah, that's true. That's true. In dentistry, it's very, very weird how we feel so strange and guilty about taking time off.
Yeah.
Yeah.
Well, our next question, Troy, that Howard Ferran comment that you made kind of leads into it that, we should be working 6 days a week, but the statistics from these slides say that in 2014, 34.2% of dentists said they aren't busy enough compared to 19.7% in 2007. So, we could work more, but if there aren't the patients to come in, then I don't know what we're going to do because it also says that total patient visits per year are down. So why do you guys think that is? Why are dentists not busy enough? Why are patients not coming in?
Did you want to take that one, Marcus?
Yeah, Marcus. Sorry, Marcus.
Yeah.
Let's start with you.
Ryder's so tired he couldn't say your name.
I forget who I'm even talking to right now.
Let's see if one of our listeners wants to call in. Oh, wait, we're not a live show. Sorry. That's a good question. I mean, I think the need is still there. I mean, I don't think it's like we've cured caries or something.
Not yet.
Suddenly people don't have the need for dentists anymore. Their mouths are in better shape. I mean, maybe there's a little bit of that, but I kind of doubt it. I don't think that's really a part of it. I think maybe patients just have the economy's affecting them too. I mean, they don't have as much disposable income to put towards dentistry. The insurance benefits that they maybe get through their employer, either they're non-existent or what they get hasn't gone up at all. And so there's just limited resources to put towards dental care. So their visits maybe go down, and I don't know. I think that may be some of it.
Yep.
Yeah, Troy, what do you think?
I agree with Marcus. I think it's a couple things. I think it is the economy because 2007 right in there was when we were having the crash. things were pretty good until then. And even the ADA, if you look at the dental wages, it's just plummeted since then, right? Remember we talked about that before.
Yeah.
Another thing is that I think that when you, look at the dentists coming out of school, I think there's an increase in the amount of dentists coming out of school versus the amount that are able to retire now. And that keeps more and more dentists in the field, therefore narrowing the patient pool, right? So I think that that's part of it too. I don't know about you, but I think that, they talk a little bit about these guys that are retiring, but dentists are retiring later and later. And we read that one article. Did we do that on the show that one time about how dentists retire later than most people?
Yeah.
So that's a staggering thing, because they're not getting any less people out of dental school.
No,
but
it's
if
increasing.
but if these guys are not retiring, we're just thinning the patient pool a little more and more and more, and it gets to a point where we're marketing so stinking much, we're giving away free services, and everything's just crappy for the dentist.
Yeah, and we had talked about that article. I think Dental Town had posted, or Howard Ferron had posted, about the Canadian dental industry is getting kind of like America, where there's so many dentists, it's getting competitive, where they have to offer free stuff all the time. You get the dentists that are offering to give $1 or $2 per bag of Halloween candy you bring in, or anything to get their name in the paper. And so it's getting so competitive that we're going to be giving everything away free just to get people in the door.
Yeah, and that's a sad state. I mean, what happened to the days when, back in the day, when it was actually illegal, or not illegal, but unethical to advertise when you were a dentist?
I'd like to go back to those days.
Uh-huh.
And I wonder if people are just spending their disposable income on other things and not valuing their health as much. Because I had a guy come in the other day, and he had a broken off tooth, and it needed a crown. And he said, I need to do the cheapest thing possible. I need to, do whatever I can. I just can't afford. I'm retired, and I just can't afford to pay for anything. All right, well, and so I ended up doing like this huge amalgam in his mouth, and as he was leaving, I noticed the car he was driving was about a $50,000 car. So I think, it's just priorities. I mean, if it's not important, but maybe that's part of it too. I don't know.
Yes, I do believe that is the case. People want to spend money on cars and cell phones and TVs and entertainment and vacations. They don't want to spend money in their mouth. Very rarely anymore. I mean, there's still probably aesthetic dentists out there, but I remember back before the crash, there was guys seminars like crazy, how to do full mouth rehab, blah blah blah, how to do all these anterior cases, blah blah, and that stuff seems to just have trickled off, and it's gone because people just aren't doing that anymore. At least not to the extent that they were, clearly.
Yeah, you're right. Now there's a bunch of classes about how to get a patient to not cancel.
Yeah,
stuff like that.
I mean,
that
for
was
sure
unheard of before.
Well, that was my week.
Dental school.
I talked to it this morning. I mean, I seriously have had a feast and famine week. I have not. I mean, cancellations are just coming out of my ears, and what can you do? You can't get a van and go drive around and pick people up.
No, well, I don't know.
I guess
that's not a bad idea.
Hey, there you go. We're onto something.
Yeah, I don't know either, because I saw, just searching around the internet and stuff, probably 5 or 6 different consultant companies saying, they can guarantee they'll have the schedule full, and how to guarantee nobody cancels. I'm thinking, I don't know how you can guarantee that nobody cancels, because some people just have in their mind they're just not coming to the dentist, or they're going to, reduce no-shows. Yeah, I mean, the three of us have been coached on how to do all that. Our staffs have been. But there's only so much you can do, and I don't know how they can guarantee that you don't have a no-show or something like that. It seems nearly impossible to me.
Is it just me, or does our population have a lot less respect for people's time now?
Yeah.
I mean, I was always taught and born and raised that, if I said I was going to do something, I needed to tell them that I wasn't going to be able to make it for whatever reason, and give them enough time, 24-hour notice. But we got people that will literally not show up. We talk to them the day before to confirm their appointment, and they just won't even show. They won't call. And you're kind of like, what? And then the next time you see them, they don't even say, hey, I apologize or nothing. It's almost like, hey, screw you guys. This is my time, and I can come when I want thing, I'm getting more and more of that in this society nowadays. I don't know.
Yeah, I actually, we had the eclipse, what was it, a few weeks ago. I had a patient no-show on eclipse day, and I thought he was just scared. I don't know, it was for, I think, about a 2-hour appointment. Well, his wife came in a week or so later, and, I talked to her. I said, if he, whenever he's ready to schedule, whenever your husband's ready to schedule, let me know. She had brought it up, and she goes, oh, yeah, well, he knew he had an appointment that day. He just wanted to go see the eclipse, so he just blew off his appointment. I'm thinking, he didn't even have the courtesy to call and let us know that he wasn't coming. He knew he had an appointment. He just decided he drove up to Marcus's neck of the woods and to see the eclipse. And I thought, yeah, you're right, Troy. They
Very
just don't respect time.
very inconsiderate society right now. And rightly, they do have us in a interesting predicament, because if they don't show up, we're pretty much at their beck and call, but
yeah,
it's still, be considerate of our time. I mean, we're paying staff to sit around and twiddle our thumbs because you decide to not come to your appointment.
yeah.
I mean, at least give us some forewarning so we can fill it with somebody.
Yeah, and it seems like most patients are courteous enough to do that, but you get those few, and man, it can really wreck your day and put you in a bad mood too.
Yeah. So if people don't want to come to the dentist, dentists aren't going to be busy. That's for sure.
That's for dang sure. Yeah. Truer words have never been spoken. Well, let's move on to our next one. These guys said that by 2020, 32% of dentists will be female, which is probably a good thing because females are much more caring than we males. But Marcus, how do you think this is going to affect dentistry to have so many females in the workforce?
Yeah, they did talk about how it's not necessarily like it's a bad thing or something to have females in the workforce. I mean, they're every bit as capable as men, and in a lot of respects, they're far more compassionate and maybe have a softer demeanor and touch than a man would. But there's also the reality that women do become pregnant, and in a lot of cases, and do have children, and that requires rightfully so, a significant amount of time with the new baby, or a choice to stay at home, and so obviously that can affect a practice, and so it's less likely for female dentists to be solo dentists or maybe practice owners, because it's harder in that scenario to be away from the practice for an extended period of time. So again, it's a trend where if more and more practicing dentists are females, that it's another nudge in the direction of a group practice or a corporate type entity, where it may be a little more feasible to be away from your practice or not practice for a longer period of time.
Yeah, that's true. I don't see it as a bad thing, but that does affect things. We had a lot of female dentists in our class. It seemed like probably about a third of them were female out of 75. I would guess.
Probably, maybe even a little more.
Yeah, and they all seem capable, and probably more so than about half of the men in our class, I would have to say. But
hopefully they're not listening.
Yeah.
Hopefully those men aren't listening.
Yeah, because they know you. They know where you live.
I hope they don't. I don't even know if you know where I live, Troy.
Actually, I'll find you.
So, Troy, how do you see the women in dentistry affecting dentistry?
I think female dentistry. If you're a female, I think dentistry is a pretty good field for you, because I think that if you want to work part time and of course you have family obligations and stuff, it's actually a really good career for you, because look at hygienists. I mean, I have one hygienist that's full time. All my other 5 hygienists are part time. And they're home with their families. It's the same type of thing, just the putting the doctor hat on instead of the hygienist hat. You'd have to look at practice ownership, like Marcus said. It might be a little bit tricky if you're looking to take a bunch of time off, or whatever. You'd have to have somebody come in, or else your practice would suffer. But I think it's good. They're compassionate. I think that females make fantastic pediatric dentists.
Oh yeah. I would
man.
say so. They're much more patient with kids, caring. Yeah, for sure.
Yeah. So if you're females out there, you want to be a dentist, maybe consider pediatrics.
Yeah, we'd appreciate that.
Yeah.
I think those are great points. Well, let's move on to our next topic, and this is where we might get a little feisty. and we might get a little angry. So, well,
we are realists, right?
We are real, and we're going to tell it like it is. So, in a dental products report survey, dentists rated their satisfaction with the various aspects of their jobs, and insurance reimbursement was by far the lowest at a 2.43 average out of 5. Which 2.43 average, that seems kind of high for me, but it was the only response below 3. But guys, let's start with you, Troy. How would you rate your satisfaction with insurance reimbursement on a scale of 1 to 5?
I would say 0.
Yeah, that's exactly what I thought. I can't believe
2.43 seems pretty.
That's
high.
outstanding. Insurance companies should be happy for that number.
Yeah,
I'd like to know who they interviewed on this thing.
yeah.
Because if you interviewed solo practitioners or people that are actually in the real world, I can guarantee that number is going to be lower. This is probably people in academia who don't deal with insurance.
Yeah, it seems great. They donated $50,000 to my dental school.
Exactly. That's why we have the Delta Dental Room in in our dental school. That's interesting, isn't it? You don't have some dentist because, you know what, we can't afford to donate to our schools anymore.
Yeah. Yeah. Marcus, how would you rate your insurance reimbursement?
Yeah, it's extremely poor.
It's almost comical.
It is. I think you were telling us a couple of weeks ago some crazy reimbursement you got on a crown, and it's to the point where you're like, holy cow, how do you participate with some of these plans and still have any kind of profit left over? Especially if you're practicing in an area where they know it's saturated with dentists, so they can pretty much dictate, well, we're going to pay you this and you're going to take it.
Yeah.
Because what else are you going to do?
Yeah. I think, though, I can't remember which insurance it was, but I think the crowns they paid or allowed $470 or something like that. Does that sound about right?
Yeah. I think that's
holy
what you
cow.
said.
Was that a tinfoil crown?
That,
Just get some aluminum foil out and just mash it around the tooth and send the patient home.
I mean, I don't even get how. I mean, the insurance people they probably put that out as a joke and thought, let's see if anybody bites. And of course, every dentist in Utah did. I don't know.
You know what,
I mean,
Marcus is
hitting
hitting the nail on the head there, though. Because this is the distorted thing that's happening in dentistry right now. Insurance companies have a incredible amount of information on dentists and their fees and how many dentists are practicing in certain areas and blah, blah, like Marcus said. Dentists, on the other hand, we have antitrust laws. We can't go talk to other dentists and say, hey, what's your fee here? And price fix. We can't do anything. Our hands are absolutely tied. So these insurance companies use that information that they can get legally that we cannot get, that they can totally just ruin our lives. And like he said, Marcus hit it on the head, they can tell you, look, dude, if you don't do it, Joe Schmo down the road's going to do it, and you're not going to have any patience. And they totally do that, and it's a sick thing that's going on right now.
It is, and I've seen a lab around my town where you can get like a PFM for like $50. I had one dentist I know that used the lab, and he said, you had to do a ton of adjusting. They didn't really fit that good, but at some point it's going to come down to something like that. And of course, the ethics and quality, it's all on us as dentists to put good things in the mouth. And I'm not going to lower my quality for things like that. It's just going to force dentists to get out of dentistry, it feels like, because at some point lab fees keep going up, and they're going to get to be almost as high as what you're going to end up making on the crown, and it's ridiculous. But we can't talk about how much we charge for anything, but I'm sure the insurance companies know what other insurance companies are reimbursing, and they can all drive the prices down. I don't know.
Yeah, they can conglomerate together, but we can't.
Yeah.
It's wrong. It's very wrong.
It is, and what motivation do they have to pay us more? Because there's always going to be one guy down the street that's going to take $50 less than everybody else just to take all the patients, and I don't know.
Yep.
ADA, are you listening? What are you doing about this?
Right. This is one of the major problems.
Yeah.
The thing, and then we've talked about it in previous podcasts, and I don't know, our listeners may be sick of us talking about it, but this is a major problem right now in dentistry. You come out of school, you're buried in debt, you can't even make money doing dentistry with these reimbursements, making $400 and some on a crown. Are you kidding me? That's insane. I mean, we're going to have to start going to China. We won't even have a choice, because if you don't, like you said, Ryder, you can't even provide the service because my overhead is going to be more than the dang crown is, you know.
Yeah.
And you can't do it for free as much as you'd love. You'd love to do it.
Yeah. Well, I don't know. It's weird. It is a strange thing, and I can remember when we got out of dental school, people, dentists would say, insurance, it sucks to work with insurances. It's a bunch of crap. But then when I first got out and they were sending me checks, I thought, oh, this is great. I don't see what the problem is. But then you start realizing, oh my gosh, we are not getting paid nearly what we're worth.
Yeah. Well, then you take your cost. You say, okay, this procedure costs me $70 to do with all the equipment, all the sterilization, my staff, all the supplies, everything we do and touch and have to turn over. And the insurance will give you, $50 or something like that. Well, that's $20 less than it costs me to actually perform it. I mean, it's not quite to that point, but it's getting closer.
It will get to that point, yeah.
And, I don't know about you guys, but I've had dental insurances over the last 2 years have actually been cutting reimbursements.
Yeah.
They aren't raising anything. You aren't getting more money. They aren't going, oh, we understand that your supplies are going up, your lab fees are going up, and that kind of stuff, so we're going to cut you a little break and give you more. No, they cut them. And guess what? Because you're signed up with that thing, you're just going to sit there and go, okay. And it's going to come to some point where the dentists are going to break and you won't be able to afford to do it anymore.
Yeah, it's totally true.
Yeah.
Well, let's talk about some more insurance stuff, because you can never talk enough about that. What about these insurance audits? So the insurance audit is basically, if you do a procedure, say a crown, they send back asking for more information. So have you guys noticed these increasing at all? Marcus, have you noticed any increase with where you're working?
Yeah, I mean, where I'm working, we deal with a lot of the same stuff. We work with a lot of insurance plans, and so, I mean, when I was in private practice and soon after dental school, you'd do a procedure, you pretty much just submitted that you did it. Unless it was maybe a crown or something like that, they might ask for a radiograph, but anymore they want more details. The trend is towards additional codes and additional diagnostic codes, beyond just what we did. In this class, they talked about how it's coming for dentistry. In medicine, they have all sorts of diagnostic codes that they have to submit in addition to whatever the treatment was that they performed, and that's where dentistry's heading.
Yeah, Troy, have you noticed an increase where you are?
Yeah. I just can't believe insurance reimbursements are terrible, as we discussed, and we can go on about that forever. But then the fact that we have a whole bunch more administrative time needed to be able to get reimbursements from them. They'll decline something for some stupid reason, say, oh, we need a different x-ray or a different angle, or we need an intraoral picture of this. We need this. And so you're sitting there paying a front desk lady, 2-3 hours to try and collect $30. And it's ridiculous. It's absurd. I mean, I kind of understand the insurance companies' take on it. Of course, they don't want to get taken, and if dentists have been dishonest, then we've caused our own problem. But it is absolutely crazy what we've been getting. We've had a horrible time lately with periodontal disease and trying to get scaling and root planing pre-authorized. I mean, they are going crazy on that stuff now.
We are too.
They really want you to let the patient get worse before they do it. You know what I'm saying? Like, it has insufficient number of pockets. Oh, okay. Yeah. So 3 pockets is not sufficient. We need to wait till we get to 5 to 10. Maybe we should wait until there's actual, pus and stuff like that. Maybe we should just let the bone melt away a little further. Yeah. We were taught to attack things pretty aggressively.
Yeah.
And periodontal disease, you got 1 5 millimeter pocket in the mouth. That's a dangerous little thing. That's going to spread around. We got to attack that. Well, insurance companies won't do it. And then when you tell your patient, look, your insurance isn't going to cover this, we're going to send all this information in, and they're going to say no, and it's going to cost you this out of pocket, they'll say bag it,
Yeah.
They don't want to pay for that. So we've really been struggling with this.
Yeah, I've been noticing more and more. It seems like on just about every crown I do, they want like a narrative about it. I actually had one this week, and this was the worst one I've seen. It was for this lady had a bridge removed. I removed a bridge that ran from 3 to 6. She had recurrent decay under an existing bridge on number 6. I had to send her to the endodontist to have a root canal, a retreat on the root canal. And then he sent her back to me. We prepped the bridge from 3 to 6, sent it in. Comes back, they want to know all of her missing teeth in her mouth, all of the missing teeth that had been replaced, all of the missing teeth that had not been replaced, any existing bridges she already had, the periodontal status of the bridge that we were putting in, and what the 5-year prognosis was.
The 5-year prognosis?
The 5-year prognosis. It said the 5-year prognosis, and I thought, I don't know. What if she gets hit in the mouth with a baseball bat? That's bad. That's a bad
What happens
prognosis.
if she doesn't brush her teeth?
Like,
who knows? Who knows?
The heck knows?
That's like a crystal ball question.
Yeah. And, I was talking to my front office girl that works for me, and I'm like, I was asking about another one that I got, and she's like, what I want you to write is just, she needs a crown. That's why we did the crown. And I'm like thinking, yeah that's exactly right.
Yeah, because I'm a licensed dentist, and this is the way I was trained, and then, I mean, come on.
Yeah. We were pre-authorizing an upper denture and a lower partial for a guy. He had all his upper teeth extracted and all of his lowers except for 22 to 27. Well, the dentist, I guess she said she was a dentist from the insurance, called me and asked me why we were doing this. And I said, well, he doesn't have any teeth. I mean, that should be pretty self-explanatory. Mm-hmm. And I was kind of defensive because it felt like she was questioning my either ethics or my diagnosis or something. And then she said, well, why did you save 22 to 27? And I said, well, the patient wanted to, and they were savable teeth. Well, he's had a perio condition in the past. Well, no kidding he did. He's lost like 70 teeth out of his mouth. Yeah, he's lost most of his teeth. I understand. I'm the one that diagnosed all this. I understand. I'm the one that looked in his mouth. You looked at a pano x-ray, and man, it's like.
Was she asking maybe you should just take them all out and go to a denture because we don't want to pay for this crap?
That's what she was saying.
We don't want to pay for the perio maintenance.
That's what she was getting at. Is maybe he should have just had them all taken out. Well, maybe he should have. Maybe you should get into private practice and actually do some of that stuff, lady. I don't know.
Yeah, and maybe you should go tell the patient that because dentures suck. Yeah. And guess what? A partial is actually doing the guy a favor.
Yeah. It's and that's what I said. He didn't have much bone down there. I didn't think the suction would be good. Saving some teeth is by far a better option, even if it's temporarily. I don't know. It really ticked me off.
That gets you furious. Oh, I had just on the same topic. I had a guy come in today. His wife came in for her prophy and stuff, and she was upset with the surgeon that I had sent her husband to. Had a vertical root fracture on number 30. And ended up losing it and ended up having to got an implant in there. Well, the insurance declined it because they said a partial could have worked there.
Yeah. Yep, I've had that too.
Okay, I have not had. That's the first time I was like going, what? What happens when a patient wants a dental implant? You know?
What if they just want it?
Yeah. I mean, they don't want this thing coming in and out of their mouth for one tooth. Not only that, I don't do those little one-tooth partials. Those are old school.
Yeah, I've had that before too, and I think that's on this one where they asked all the information for the bridge. They wanted to know if there were any other missing teeth that had not been replaced, because then they could say, well, a partial would have been fine. No, partials suck.
Yeah.
I mean, if that's all you can do, that's fine, but
it's definitely secondary to a bridge, or definitely third to an implant.
Yeah.
Please, people. I mean, come on.
Yeah, I don't know. I don't know.
So they were upset that the insurance wasn't covering it. It was all out of pocket and all this stuff. And I'm kind of like, I can understand why you'd be upset. But on the other hand, the guy's getting an implant, not something that's coming in and out of his mouth. But, it's hard to tell people that after the fact. They're just, had we known it was going to cost us this much money, we wouldn't have done this.
Yeah.
And I'm like, well,
Yeah, and then that's, I feel like that's a conversation they need to have with their insurance, but it seems to kind of come back on us. Like, how come you didn't know that?
That was the patient's take on it, exactly, Ryder.
Yeah.
She was like, why doesn't he pre-authorize like you guys do? It's like, I don't know. Talk to him. I mean, he's a surgeon. I'm the dentist. We pre-authorize certain things here, yes. So certain things we know how the insurance handles stuff. I don't know why he didn't do that. What do you ask me for, you know?
Oh, man.
Yeah, so that's our life in a nutshell, eh?
Well, my blood pressure's high. I don't know about you guys.
Love it. Great stuff. Yeah, that's a frustrating thing when you know what's best for a patient. The patient wants the good treatment. The insurance fights it. You end up spending so much money trying to get them to reimburse what little amount they do, and it just wears on you, and it's fatiguing.
It is.
I mean, bless those ladies up front that can deal with this stuff, man. I like you would say, Ryder. If someone called me, I'd be yelling at them on the phone.
Yeah, I was.
I'm like, you gotta be kidding me, lady. You gotta be kidding me. Do you have a license to practice dentistry?
Yeah.
I actually want to ask some of these guys that sometime.
Yeah.
These insurance people.
Yeah, when I've had to write a narrative, you know, I'll sometimes put in there, and I don't know if it's even helpful at all, but you know, if this is my diagnosis, this is why we did what we did. If you would like to have your dentist on staff call and discuss this with me, I can explain it to him. But most of these insurances, I assume, and I think in some cases we can probably say for sure, they don't have dentists even on staff. They just have rules that if it's this, then we don't pay for it. If it's this, we'll pay for it. Like you said, if it's perio, then we're going to want 75 perio charts and, you know, a history and all this. And I don't know.
Yeah, we want 20 years of perio charts. The patient's been in my office for this is the first time, and they don't even remember the name of the dentist they were at the last time. How am I going to track down all this information for you to cover $20 of this service? It's crazy. Yeah, but this is the world we live in. You either do that or you don't get paid.
Yeah, and even then you might not get paid.
Yeah. That's true.
Even then, you get $470 for a crown.
And then, I get patients that will not do the treatment unless their insurance company will cover it.
Yeah, yep, I do too.
No matter what it is. That's really
frustrating. Yeah, it is frustrating. The insurances have got these patients snowed, thinking that they know what's best for them, and they want what's best for them. It's not true.
If they don't cover it, I don't want to do it.
Yep. Yeah.
Yep.
Yeah. Well, guys, should we wrap it up on that note?
Let's do it.
Yeah.
Everybody feeling good about things? Wow. Well, Marcus, do you want to tell everybody where they can find us and get in touch with us and everything else?
Yes. You can find us on Facebook. We've got a Facebook page, Dental Realist. We're also on Twitter at Dental Realist. You can reach out and send us an email, dentalrealist@gmail.com. We love to hear from our listeners, and we appreciate all of you supporting us and listening to our podcast. And we hope the information we're sharing with you is helping you in your practice or in your future endeavors in dentistry. You can also pick up a couple of books that we've written. There's So You Want to Be a Dentist, focused kind of a little bit more on people that are looking into dentistry as a career. And then So Now You're a Dentist, and that book is really for any dentist that's practicing, but it does help especially those dentists that are new to the profession. And you can find those on anywhere where you can get a digital book, Amazon.com, the iBook store, print copies. Great reads and a good resource.
Yeah, so we thank everybody for joining us, and we will be back on episode 27. This has been episode 26 of the Dental Rules podcast, and we'll talk to you next time. Thanks.